I study preterm birth and the basic physiological mechanisms that lead to preterm birth. And we are trying to understand the pathway. So we're developing new molecules that can block key steps in the pathway that leads to the delivery of the baby. We don't have a good estimate of the hidden costs of prematurity in either the United States or Canada, but if we did, it would really amplify the problem. I'm doing what I think are the best projects that I'm capable of doing, that my interests and my talents and my experience allow me to ask. So I'm actually, at this point, having the most fun and being the most productive, I think, in my entire career, because after all these years, I know what questions I want to ask and how to go about addressing them and answering them. And I have a wonderful team of collaborators that I work with. Preterm birth is a complex problem. So I think that what folks are going to do are to recruit other good investigators from many disciplines. So I think the field will be very interdisciplinary or even transdisciplinary, where people from two disciplines work at the borders or the edges between their two disciplines, which is maybe the most exciting, and they ask questions that neither alone could ask, but together they ask some very exciting questions. So we'll see all areas of health involved. We'll see neuroscience involved. We'll see nursing involved more than they are already. Epidemiologists involved. There's hardly an area of health research that I don't think could be involved in the study of preterm birth at some time, because all the systems come to play in the total picture of preterm birth. So I think that in 10 years we'll see a number of inter and transdisciplinary teams being developed and studying the problem, and very, very rapid progress being made. So we need to overcome these barriers. We need to find smarter ways of assessing women who are at risk but not yet in labor contractions, so that we only give the drug to women who really need it. We need to come up with safer drugs. I think that we'll have developed new drugs that can block preterm birth, and I think we'll have a new test that will assess women who need those drugs, but before they actually go into pre-labor contractions. But there are some solutions out there on the horizon. We're very excited about the possibilities.